One of the major activity that happens when a person dies in a health facility is actually the body transfer from the location, if it's in a ward or if it's in any other part of the hospital, to the morgue where the preparation of the body would be done. Initially, again, because it is new, it was recommended that the body should be placed immediately in a body bag. Now that recommendation has been modified to state that you can just wrap it and you can then take it down to the morgue because it does not really pose a threat for spread. So we look at a very important component in the transfer of that individual from the room where the patient was to the morgue, and it's a containment of body fluids. And these are standard precautionary measures that are done by anybody. And it's actually to ensure that all these orifices that would be oozing liquid must be capped so that there is no release of liquids while in transport. And then, of course, the body would be wrapped and then as soon as possible and sent to the morgue. Of course, all supporting lines that would have been on that individual would have been removed. At the level of the morgue, there are several things that are done there. In terms of the morgue in Belize, we do the washing of the body, the tidying, the tidying of hair, trimming of nails, or shaving. Those are basic procedures. We want to say that in this process of preparing the body, you need to ensure that you do as little handling as possible. Notwithstanding, you might have all the PPE, you need to ensure that you maintain limited handling of the body. Autopsy has never been something that is outrightly supported unless there is the significant need for additional documentation in terms of the cause of death. We also need to take into consideration that the environment in which the body is housed in the morgue, the virus can remain on the surface up to 9 days if not properly disinfected. And so and that's why we try to limit the body in the morgue in terms of handling and actually conducting any invasive procedure. In fact, we don't recommend for even the embalming of that body. That has another connotation when it goes to the community setting, when that body is introduced into the setting, and that is not something that has happened with the first 5 cases that we've had. No, the first 4 cases. The 5th case, actually, it was given to the family to do burial.